So all of these measures that are being taken, some say 30, some say 50, depending on which paper, which report you're reading. What kind of feedback, how impactful are they? So and what do we need to do to keep moving forward? Well, this morning we've got Muhammad Yakubu, who is a founding member of the ACF, is also a former council member of FUTO, as well as SA Political, to the president of the 8th Senate. He joins us from our studios in Abuja. Good morning, and thank you for joining us today. So you've seen several measures that are being taken by the authorities, and they keep reviewing these things and then coming up with new measures, they say. What is your impression of how this is going at the moment?
Yeah, thank you, Mr. Chamberlain. Good morning, Nigerians. This is not time for lamentation. This is the time that the patriotism, faith, and humanity in all Nigerians should come to the front burner. This is a global pandemic. There is no country in the world that is prepared for this kind of a crisis on this unimaginable scale. Be that as it may, I don't think this is the time for us to crucify ourselves for our inadequacies. Anything the government is putting in place now, what I think we should do as citizens is to find a way of seeing how the government can improve on those palliative measures that will help the citizens, and find a way that the palliative measures will trickle down. Some of the stories coming out since the breakout of this COVID-19 has been very worrisome, and it calls for concern. But I know the can-do spirit of Nigerians and the things government is putting in place will see us through by the grace of Almighty Allah. It's difficult, it's tough, but I'm sure we'll come out of it very strong. It's not something that is a global crisis. Countries that we think we look up to, countries that we think has the capacity to manage this crisis, we have seen how overwhelmed they are. So if we are overwhelmed here, I don't think is a new thing. And I think this is the time we should support our government, support our people, see how we can be our brothers' keepers.
Alhaji Yakubu, I mean, there has to be specifics. You know, the reason why they hold all those meetings and press briefings is to get feedback from people such that they know what the measures that they are putting in place, are they achieving the results? They need help and feedback from us. So from what you've seen, how are they making the desired impact?
It's a bit slow. It's a bit slow. They are achieving progress. It's a bit slow. We shouldn't crucify ourselves for our inadequacies. Like I said earlier, this is not something anybody planned for. It's a problem, is a pandemic, you know, across the world. Even the advanced world, the advanced countries like America, Italy, Spain, and so on, you can see how overwhelmed they are. So we should learn lessons, and I want to appeal to our people. This is a time for empathy and appeal. It's not time for force, or time for lamentation, or time for castigation. I want to appeal to our people that we should please make this sacrifice for this country. And the government too should listen with wisdom and be patient with our people. It's not all criticisms at this point in time that the government should see as coming from opposition. In this period now, there should be no APC, there should be no PDP, there should be no religion. What should come to fore is humanity. The spirit of forgiveness should also come to fore. The government alone cannot do this. We have to help. We have to help the government, and this is the time Nigerians should come out and see what they can do for their country.
Alhaji Yakubu, could you be a little more specific? When you say the people need to, do what they have to do, what specifically have you seen the people do that you don't think should be done? Or what should we do to support the government? Specifically now, what actions?
Yeah, what I think we should do, what I think we should do to support the government is complying with the government policies that have been rolled out, like staying at home, slowing down the spread. Then in this palliative, like you've just, a clip I saw now before we started this interview, where distribution of these palliatives are going on. It is not properly organized. I think the government should do more. And at this point in time, I think the government too should reach out to social-cultural pan organizations across the country, like the Ohanize, the ACF, the Afenifere. Then traditional rulers too are important. They can be very, very helpful. And religious bodies too, like the CAN, the JNI. We have other groups. Fortunately for us in this country, a lot of groups have umbrella bodies that could be very helpful, like the NLC, the Nigerian Student Association. They can be very helpful. And this time around, I think there is something I will appeal to the president to do himself to help douse the tension and to help slow down what is happening now. The president himself should call on his former colleagues. They have not spoken out enough, and call on some leaders and elder statesmen in the country and see how they can be of help in the situation we find ourselves now. There should be, like I said earlier, there should be no PDP, there should be no religion, there should be no, what should be at the forefront should be humanity and our can-do spirit. And I know we will come out of this stronger than we are. Because already we have, before this crisis now, we have a lot of deficiency in a lot of areas. So this time around, the moment we pass through, we get across, we are able to pass through this successfully. I think the government need to sit down and go back to the drawing board and, do the needful.
Now, in terms of those of them who are out there, because, I mean, sometimes when you step out there, you hear narratives as to, well, they're not exactly sure if this COVID is meant for them, going to affect them. Of course, you know that those narratives shouldn't be. But there are people who have that kind of impression. And the authorities have been putting out messages to see how they could dissuade them. So what about groups like yours? Are you aware of any such messaging or impression from people? And have you done anything about it to see how you could let them know that, no, that's a wrong impression, and actually this is real, and they should conduct themselves as expected by the authorities?
That's why I've mentioned these groups I've mentioned now, that the government should reach out to them. One of the basic and fundamental things the government should be doing now is sensitization. I'm aware that the newly inaugurated ESCO of the ACF, they are doing, very soon they will roll out some of the plans they have to complement what the state governors are doing in the north. Sir Ahmadu Bello Foundation has started something. Sensitization, it has started sensitization. It's doing, most of our people in the north are rural people. They listen to radio. They don't have access to televisions and so on. So these are areas that I think if the government reach out to the groups I've mentioned now, umbrella bodies of the group I've mentioned now, they will go a long way in helping the situation, in helping in sensitizing the people, and in helping in slowing down the spread. What we need now is sensitization. It will help us in reducing the spread a great deal.
Aside sensitization, a lot of people are also saying there should be some form of palliative. And the federal government says, all right, no problem. Yesterday, they started disbursing 20,000 naira to, I think, 1.2 million people. We hear there are plans to add 1 million people to that particular process. But if you take a look at the margin that is still left to go, it is wide. And I'd like to find out the role I mean, organizations such as yours, or how can the government reach out to others? Because there have been questions about database, and you say that you have organizations like yours that can fill in that gap. In what specific ways do you expect the government to perhaps hand over that money to organizations like yours, and then the money is dispersed? Or how can the government reach out further to people that will be adversely affected by this?
That's why I've told you that organizations like ours and the traditional rulers can, JNI, these umbrella organizations can reach out effectively and more organized to the needy, to those people that need these palliative measures. And already some of these organizations have started, because I saw RGCC, I think the leader of that Christian group, I saw them in the papers, I think some few days ago or so, doing some distribution, doing some things about the situation now. And like I told you now, Ahmad Bello Foundation in Kaduna are doing something. The problem we had now is that the new elected leadership of ACF was caught in the lockdown. But that be as it may, they are still working behind the scene. Very soon, in a couple of days or so, they will roll out some of the Marshall Plan. Areas they think they can help and support the government. I'm not saying that the government should take money and give to these groups to go and distribute to people. No, what I'm saying is that they have more organized ways of reaching out to the people, and they can sensitize the people. What we need now is sensitization to slow down the spread. Because like you said, we have information that quite a number of people don't believe that this is real, and we have a lot of a higher percentage of illiteracy, particularly from the north, which needs sensitization. And the government alone cannot do it. So with this group, they can, in collaboration, in synergizing with the government, it will go a long way in helping the government, in slowing down the spread and convincing the people that this is real.
Themselves will need some form of reliable information from government officials. Okay, so we have agreed that government needs to do a lot in educating, in sensitizing the people, informing them appropriately. But what roles do you see state governments performing so far, and what gaps do you see that the state governments themselves need to fill? Because it seems that everyone is only looking to the federal government most of the time. We've heard the angle that you've talked about, these CSOs and these other sections of society, such as organizations like yours. But what gaps do you think state governments themselves can fill in this whole process?
The gaps I see that the state government can do is that they can fill is that I've not seen enough coordination or enough synergy between the state governments and the federal government. Like some states, you can see disparity in the dates of their lockdown and so on. This is a global pandemic. It needs a holistic and a well-coordinated approach in slowing it down and in taking care of it. So I think the state governments, luckily for us, or fortunately for us, the state governors have an umbrella of a governors forum. So they can meet with the government and agree on how to do whatever needs to be done in uniformity. No state should say, because it has not reached my state now, so I can still continue to play the ostrich. The lockdown should be total. Whatever needs to be done, there should be a synergy. There should be a coordination between the federal government and the state government. No state government alone can do it. It has to be, the world alone even cannot do it. It needs collaboration.
Well, what do you say to, pardon
me
to jump in, Alhaji Yakubu. Yeah, just a minute. What do you say to those who think that, haven't seen what happened in Kaduna at that time, that they thought that, you have seen leaders of thought just immediately just come up at that point and say, no, this has to be done, or certain messages, they also help join in disseminating those messages to douse what transpires such that it doesn't happen again? Do you fault those who think that those people should have stepped up and not necessarily wait for
what
government?
happened in Kaduna? Can you tell me what happened in Kaduna?
The scenarios
that you are talking
wherein
of?
police stations were attacked, wherein people are resisting those who are coming to tell them, no, you don't have to gather either to pray, worship, or do whatever. You need to stay home. I beg your pardon, Katsina.
That is where the sensitization comes in. It's because they are ignorant of the issues and the gravity of the situation we are in. If they are properly sensitized, like when I was coming to this place, the security agents I met on the road, they were very civil. They were very understanding. You know, they were very matured and professional. This is as a result of sensitization, I'm sure of. So if we sensitize the people enough, though it's not easy, it's a tough situation. You can't ask people to stay at home, and there's nothing for them to keep them at home. Almost 90-something% of Nigerians are a group of people that every day have to go out and look for what they need to eat and feed their family. As I'm talking to you now, I know the kind of pressure on me. I have to reach out to some of my friends to support me, not knowing that I am redistributing the support they are sending to me. So it's a very dear situation. So that's why, for a long time, I have not spoken. But from from the information and the news reports I have been receiving is very worrisome, and it calls for serious concern. That's why in my opening remarks, I said this is not about any party, it's not about religion, it's about humanity and the can-do spirit of Nigerian. We will get over this, I'm very sure, and we'll come out strong.
So going forward, what, in your own opinion, how do you see the people responding to this? So on the one hand is the responsibility of governments and these bodies that you talk about to hand out the sensitization. On the other hand is the capacity or otherwise of the people to receive the sensitization. For instance, we hear, and I'm sure you may have heard it as well, that there are sections of our society in the various regions of Nigeria that do not believe that that COVID-19 is anything to do with them or that is ever going to come to them. So on the one hand is government and the media giving out this information. On the other hand, is the people themselves receiving or not receiving to a large extent this information? What do you say in that regard? What can be done?
Yeah, the government and the media are doing very well, but they can improve on what they are doing. But the bottom line is that for the people to accept this sensitization, these palliative measures are imperative. Because you are talking about locking them down even if it's for 3 days, they need something to keep them alive. So that is why it is a bit difficult too for the people to accept the reality. Because if they accept the reality, they think you are going to lock them at home and there's nothing there's no palliative measures to sustain them at home.
Are you saying then? Pardon me, one moment. Are you saying that the palliatives that have been announced are not enough? The ones that are being disbursed are not enough?
It can never be enough. It can never be enough. Even in America, where they are very advanced, where we think they have the capacity, you can see how they are overwhelmed. But what I think should be done is that the poorest of the poor that needs this palliative are the people that we should try as much as possible and get across to. That is why it is imperative and it is important, and these umbrella bodies I've mentioned are going to be very, very helpful because of their network and because of their reach.
On your way to Abuja, what did you see from Kaduna to Abuja? Were you satisfied with what you saw in terms of conduct and how people were carrying on with this?
Yeah, in terms of when I was coming from Kaduna to Abuja, like I said, the security agents were very professional. They were doing their job in a civil manner. But the traffic I saw leaving Abuja to the north is scary. I saw a lot of people on trailers moving to the north, and I saw a lot of people on bikes. At times, I saw some 2-3 people on one bike. That figure is scary. And the way I saw them, they are the group of people that are not properly sensitized. They don't know, they don't believe, some of them don't believe and don't know that this COVID-19 is real. This is where we should concentrate our attention.
All right, then Alhaji Muhammad Yakubu, founding member of the ACF, former council member of FUTO, and former SA to the president of the 8th Senate, political on that. We do thank you for your time this morning. All right, so that's, I mean, there's always a lot of feedback, and we like to take that such that we can, perhaps could be a measure of where we are, what are we not doing right, how do we improve, do we need to tighten our belts? And at what point, because look, it may come to that time, unfortunately, where it will be what it has to be. Because, I mean, right now, after the first 2 weeks, remember, it's stay at home 2 weeks in the first instance. Yeah. We don't know what will happen eventually. So there are tweets, messages that people have sent in. So let's take a look at some of them, as we'll also have another round much later. So you get to see this one. I'm trying to see if I could see that.
Okay, that
Can
one.
You see that?
Yeah, it's from Dad.
Okay, Matilda.
Yeah.
Is it the same Dad Matilda?
Yeah, same Dad Matilda.
Okay, Dad Matilda. Pardon me. But this one says, the letter from that 7-year-old Vera is a challenge to everyone. It's not about what you can get, but what you can give to the larger good of humanity. The pupil deserves a national honor for that wonderful show of humanity.
It was quite touching when we read that.
This had to do with the mail that was sent in yesterday.
Yeah. Well, this one is from Adedin Kesela. It says, someone who had contact with the governor of Oyo State, GSM, went for testing yesterday here in Lagos and had to pay 20,000 naira to be tested. I thought the test for COVID-19 was free. The answer is yes.
Yes, it is free.
It is free.
Wait, I don't get it. Why will the person even decide to pay 20,000 naira?
You know, I think we should actually, you know, come out. I know that there's been talks about this, but we should actually be clear on this such that people know what to do and what not to do. I know in some other countries, if you want to take the test on your own volition, you'll have to pay. But if you come in positive, then your money will be refunded to you. But if you come in negative, then, of course, the money stays.
You have contributed to national.
You have contributed to. So I think that for those countries, here, you shouldn't pay for the test.
It's free.
If
the health minister made that announcement, he made it categorical. So for anyone to have to pay to be tested, I think there's a question there.
Well, you know, I don't know if when people say it's a thin line between fear and being realistic about what's really going on, but people, you don't need to panic unnecessarily. Was he a symptom? I mean, did he show symptoms? If you show symptoms, you call the NCDC. And then, but paying for tests, no.
And the question is, who did you pay to?
Yeah.
Did you pay to the NCDC or just some private laboratory? Maybe they tested you for malaria. But let's take a look at this one. It talks about the lockdown. It says, while we agree that the lockdown may be one of the necessary steps to take, especially due to the porosity of our health system, government must appeal to the distributing power companies to increase supply to areas on lockdown. You see, I stressed that on purpose.
I noticed that you stressed it.
Yeah, I had to stress that because, I mean, mentions are full with people saying, no light, no light.
So what happens if there's a nationwide lockdown?
Really?
Let's not go there yet. Please.
Well, there's another one from Henry. Says, the persistent absence of timelines in implementing public programs and projects is our albatross. No sense of urgency at all defeating the aim of enunciating such. I'm appalled by the response of the National Coordinator on the CBN's 1 billion naira for the pharmaceutical sector.
Yeah, that was yesterday.
Yeah.
We had him on the program.
Okay, so there you go. Send a lot more of those. We need to put out as much as we can. But we will be back in a moment. Stay with us.